Hi class, welcome to chapter 13, the trace minerals. The trace minerals are essential minerals that we need, however, they are found in trace or small amounts. And they include iron, zinc, iodine, selenium, copper, manganese, fluoride, chromium, and molybdenum. And this also includes microminerals. So sometimes you hear the word microminerals and it means the same thing as the trace minerals. The content of trace minerals in our food depends on soil quality, depends on water quality, and even water contamination in some cases, and depends on food processing. So iron is our first trace mineral. And iron is a mineral so important to us that we absolutely cannot live without it. Iron is important for hemoglobin, and hemoglobin carries oxygen as part of our red blood cells. And because of this, it's able to deliver oxygen to our brain, our nervous system, every single cell in the human body, so that we can use that oxygen, breathe, etc. Iron also forms part of myoglobin, which is found in the muscle cells, and it also plays a role in amino acids, collagen hormones, and neurotransmitters. And those are some sources of iron pictured there. It is found in animal products. It's also found in beans, nuts, legumes, seeds, some green leafy veggies, etc. Iron absorption. So in our bodies, it's important to get enough iron, but we also don't want too much iron because too much iron can harm us, and too much iron actually functions as a pro-oxidant. And once we have ingested and absorbed iron, it's actually pretty hard for us to excrete it. And so what our body does is it carefully regulates how much it's actually going to absorb, and it does so by way of this pathway. So when we consume iron in foods, it goes to the mucosal cells, which are lining the intestinal tract, and it's stored in something called ferritin, which is a storage protein for iron. This will capture iron from food and store it in the cells, and if we need it, it will release it to a transport protein called transferrin, which will travel through the bloodstream. But if we don't need it, what ferritin will do is it will be shed in the intestinal cells before it's been absorbed into our blood. So we can either absorb iron via transferring the iron from ferritin to transferrin into the blood, or we can excrete it before we've absorbed it. There are two different types of iron found in foods that we consume, and there is heme iron and non-heme iron. Heme iron sounds like hemoglobin, and heme iron is exactly the type of iron that we do see as part of hemoglobin and found in red blood cells. And so heme iron holds the oxygen, or has the iron in the center so that the iron can bind the oxygen. In animal foods, we find heme iron, and in plant foods, we find non-heme iron. Animal foods also contain non-heme iron, but they have a significant source of heme iron. And the reason that it matters is because we absorb more heme iron than we do non-heme iron. So when we eat animal foods, we absorb more iron than when we eat plant foods. This is a picture of an animal food and plant food. So the animal food is this steak and the plant food is this broccoli. And in the steak, there is both heme iron shown by the red circles and non-heme iron shown by the blue squares. Of the heme iron, we absorb 25% of it, and of the non-heme iron, we absorb about 17% of it. So even though most of our iron in our diet comes from non-heme sources, when we do eat heme iron, we absorb a lot more of it. And the absorption of heme iron isn't affected by many other dietary factors, which we'll see on our next page. So some factors that play a role in iron absorption. There are things that enhance or improve iron absorption, and there are things that inhibit or reduce iron absorption. And so Enhancers include something called MFP factor, or meat fish protein factor. And this is a peptide found in meat, and it promotes the absorption of non-heme iron from other foods that are eaten at the same meal. Vitamin C improves iron absorption. So if you're eating iron-rich foods and you eat a vitamin C-rich food like strawberries or red bell peppers or oranges simultaneously, that can improve your iron absorption. Citric acid and lactic acid from foods. Lactic acid occurs in a lot of fermented foods. That can increase your iron absorption. And small presence of fructose can increase your iron absorption. Things that inhibit iron absorption include phytates, and phytates are kind of a phosphorus storage form in plants. Sometimes they're found as phytic acid, but they're able to bind minerals. So they're a component of plants that can bind minerals, and they can bind iron, they can also bind calcium, they can bind zinc, they can bind magnesium, etc. But if you're eating foods that contain a lot of phytates with iron-rich foods, the thought is that those phytates may bind some of the iron and won't allow you to absorb the iron. And so they're found in a lot of vegetable foods. But so people who do eat a lot of vegetable foods, maybe nuts, seeds, soy, grains, legumes, rice, etc., wild rice especially, those are great healthy foods, but they can reduce the absorption of iron. So vegetarians and vegans sometimes need to consume more iron because some of the iron that they're eating isn't going to be absorbed due to phytates in their diet. Calcium, because it has a similar charge to iron, they both have a 2+ charge. They can compete with one another for absorption. And so you should not take a calcium supplement at the same time as you do an iron supplement. And then tannins found in tea and coffee can also reduce iron absorption. Overall, about 18% of iron is absorbed from diets that are mixed with animal and plant proteins, and about 10% is absorbed from diets that are only plant proteins. Foods and how they can affect iron absorption. So here we have a bowl of chili, and it looks like it has meat and beans. The tomato is going to have some vitamin C, which is going to enhance the absorption. We do have the meat fish protein factor, which is found in the ground beef here. Beans, although they're super healthy, may contain some phytates. So the beans, it's possible, may inhibit a little bit of the absorption. But overall, I would say this is a really good meal, very hearty, very healthy, and you'll be able to get some iron from it. Iron recycling. So I did mention that iron can be toxic if it's consumed or stored or kept at too high levels. But without iron, we can't live. And so it's very important for our body to recycle iron, since we use iron in every single one of our hemoglobin molecules, as well as many other factors. So what happens is, remember, we consume iron from our diet. That iron goes to ferritin. Ferritin will transfer it to transferrin. Transferrin will carry it in the blood. It will go to the muscle cells to be used in myoglobin. The bone marrow will use the iron to incorporate to the red blood cells. That's where the red blood cells are made, and produce all the red blood cells. The red blood cells will be circulating in the bloodstream and can carry oxygen. If you bleed, you will lose those red blood cells, and so you will lose iron that way through bleeding, whether it's an accident, maybe you scraped yourself, or maybe it's a woman and her monthly menstrual cycle. The bleeding during the menstrual cycle causes iron loss for women. Hence, women need more iron. Then after that, the cells travel to the liver. The liver and the spleen dismantle the red blood cells. They package the iron into transferrin so it can be transported again, and the process continues. So in this way, we recycle iron so that we always have enough for our body. Iron deficiency is the most common nutrient deficiency worldwide and one of the leading causes of death worldwide. It affects 1.6 billion people. I expect that those numbers have possibly changed slightly. In the United States, it affects approximately 10% people on average. However, certain populations have higher prevalence of iron deficiency. Women, young girls, females in general have higher rates of iron deficiency due to the menstrual cycle. Pregnancy is a time where iron needs are increased substantially due to increase of red blood cell volume for pregnant mom, as well as iron going to the fetus, as well as iron that's potentially lost at delivery with bleeding. Infants, children, and teenagers have higher iron needs because they're growing so rapidly. And also infants, children, and teenagers sometimes consume diets that are not very rich in iron. Breast milk to a mom who had adequate iron stores has about enough iron to last 6 months, but after that, breast milk is inadequate in iron, and so infants need to have some sort of iron supplement or iron fortified food or iron fortified formula. When people are iron deficient, it causes anemia. That anemia can be so severe that it actually can cause death, but it can cause fatigue, it can cause shortness of breath, reduced productivity, it can cause stunted growth, many permanent long-term as well as short-term implications of iron deficiency. Depending on how severe the iron deficiency is, it can often be corrected by iron supplementation. However, if iron deficiency early in life has caused stunting or growth retardation, we can't fix that later down the road. And so having preventative adequate iron for especially pregnant women, infants, children, and teens is so important. Iron's role in blood cell production. So iron is absolutely needed for the production of hemoglobin, and hemoglobin binds to oxygen. Without iron, we can't form that hemoglobin unit. It won't have the central iron in it, and the red blood cells will be pale. Iron actually is a deep kind of reddish, almost dark blackish color. It's very like dark maroon color, and so if we look at red blood cells under a microscope and they're kind of pink or pale, it's a clue that there might be an iron deficiency anemia. And so this would be a common test done in a clinic. Pica. So what does pica have to do with iron? And what is pica? Pica is a craving for and often consuming of non-food items. And it can be anything. It can be as simple as ice, which probably many of you have done. I know I've eaten ice before. Or it could be a little more complicated, like these utensils or this computer board. It could be starch, chalk, clay. I've had a patient who liked baby powder, and she literally would chew it during her treatment on dialysis. It can be anything. It could be cardboard. We don't really understand why pica happens. However, we do think it might be related to an underlying iron deficiency. However, it's not 100% correlated. We do see it primarily in women. We do see it in lower income groups more. Obviously, pica is not a good thing. Not only can these non-food items that you eat damage your intestinal tract, but they can also impair the absorption of the mineral that perhaps you're craving, the iron, as well as calcium and any other minerals. Iron toxicity and iron overload. So unfortunately, iron toxicity is a big issue, and that's why our body regulates iron absorption so carefully, as well as iron recycling. Our body does not want to absorb any more iron that it needs due to risk of iron toxicity. And generally, when we get iron from food sources, we're not going to be at risk of this problem. However, iron from supplement sources poses a greater risk of iron toxicity. There is a condition called hemochromatosis, and it leads to iron overload. It's usually caused by a genetic or hereditary disorder, and this disorder prevents unneeded iron from being absorbed. And so instead of excreting unneeded iron as you shed the intestinal lining, you absorb too much iron. Repeated blood transfusions can cause high iron levels because in blood, you're going to get somebody else's hemoglobin, which contains iron, but instead of that going directly to the liver for recycling, it's going to be absorbed right away. Also, you don't have an opportunity to excrete that iron. Long-term overconsumption of iron, I would say this would be from iron supplements, not necessarily from foods, can cause issues. And iron overload can cause heart problems, liver problems, joint problems, even death. In children, toxicity from iron and iron overdose is one of the most common poisonings. And what usually happens is a child finds the parents' multivitamins or gummy vitamins or iron supplements that are usually red in color, and they think that they're candy or something good to eat. They overconsume them, and then iron toxicity can result. Some of the symptoms of iron toxicity in children are nausea, shock, confusion, rapid heart rate, diarrhea, and vomiting. Iron sources. So these are some sources of iron pictured here. I would add a couple more sources. One of them is cast iron skillets. And then vitamin C is not a source of iron, but if you eat any of these things with vitamin C, it's going to increase your absorption of it. Cast iron skillets can increase the iron content of eggs 3 times. And in some countries where we do see iron deficiency, they actually make something called an iron fish. And it's literally a piece of iron in the shape of a fish that they can throw in any sort of cooking or vehicle, like a pot or a pan. And since it's made of iron, that iron dissociates into the food. And when they eat the food, such as rice that they're cooking, they get some iron. So cast iron products, cast iron fish, cast iron skillets do increase iron sources in the diet. Zinc. So zinc is another one of our essential nutrients, and it has so many important functions. It's part of many enzymes. It's important for insulin action. It's important for DNA and RNA. There's something called zinc fingers. It's needed for protein synthesis, immune response, wound healing, transporting vitamin A, taste perception, sperm production, and fetal development. And it's a cofactor used by over 100 enzymes. It's mostly found in the muscle and bone in the body, and it does come from a lot of animal sources. I've had a patient who was zinc deficient before, and he came to me and he told me he couldn't taste the difference between a peep and a pickle. A peep, one of those little marshmallow guys, and we started him on some low-dose zinc supplement, and within a few weeks, his taste improved significantly. We do commonly give zinc in the hospital for wound healing, especially in large surgical incisions or pressure ulcers. Zinc absorption is regulated by something called metallothionein, and zinc is actually kind of similar to iron in the way that it's regulated as far as absorption goes. It's also inhibited by fiber and phytates, which were found in some of the foods I previously discussed for iron. So zinc circulation, again, this picture looks a lot like the one for iron. We get zinc from food sources. The mucous cells or the mucosal cells can store excess zinc in metallothionein. If we don't need zinc, it's excreted in the intestinal cells. And so our body says, no, we don't need it. Let's just get rid of it. If we do need it, then metallothionein is going to release zinc to albumin, which is a protein made by the liver, and transferrin, and it can be transferred for the rest of the body. The pancreas uses zinc to make digestive enzymes. And so in this way, zinc can be recycled because when we eat, those digestive enzymes made by the pancreas are going to travel back to the intestine and then can be reabsorbed, can be packaged in this metallothionein, and if we need them, we can release them, and if we don't need them, we can excrete them. Zinc deficiency. So we don't see zinc deficiency, at least in a clinical sense, a lot in the United States, but we do see it in developing countries. Some of the symptoms include growth retardation, impaired development, diarrhea, digestive issues, nervous system impairment. We do see severe wound healing delays as well as issues with the immune system. So this is a picture of a baby who has issues with wound healing and is having some skin issues developed due to zinc deficiencies. We do see zinc deficiency more commonly in young children as they're growing rapidly, elderly due to reduced intakes and potentially reduced absorption, and low income individuals. Zinc toxicity. So again, I don't see toxicity a lot in practice. However, it would be possible from consuming supplement forms of zinc, or if you had some sort of impaired absorption excretion mechanism, kind of like with a genetic disorder for iron. Zinc can interfere with copper metabolism, and so it can actually contribute to signs and symptoms of copper deficiency and can contribute to heart disease. Sources of zinc. So we do see zinc in a lot of protein-rich foods, meats, dairy products, almonds, etc. It is decently common for vegans to have low zinc intakes. So vegans, vegetarians just have to be conscious that they're getting some non-meat sources such as seeds, nuts, whole grains, etc. Iodine. So maybe you've heard of iodine or iodized water or iodized salt. Iodine is very important to our thyroid, and our thyroid has a huge role in metabolism. And without iodine, we wouldn't be able to produce the thyroid hormones, such as thyroxine. So when we have iodine deficiency, one of the things that happens is a goiter forms. And what a goiter is it's your thyroid growing and growing and growing because it doesn't have enough iodine, and it's trying to produce this hormone, so it grows and grows and grows to try to do it, but it can't do it because there's not enough iodine. Iodine deficiency is the most common cause of preventable retardation worldwide, and preventable retardation due to iron deficiency is called cretinism and can cause brain damage, as seen in the picture on the right, as well as some facial kind of deformalities. It affects 6 million people worldwide, and pregnant women as well as infants born to pregnant women who are iodine deficient are especially susceptible. Cretinism is irreversible. Goiter, if caught early, is reversible. And goiter affects 200 million people worldwide. Selenium. So selenium is a nutrient you may not hear that much about, but selenium functions kind of like vitamin E, and it acts like an antioxidant. So it protects our cells from oxidative damage by scavenging free radicals. It's also involved in thyroid function and has some similar sources to zinc, although it does come from some vegetables as well. Selenium is found in soils, so if vegetables are grown in soils, or if grains or plant-based foods are grown in soils that are selenium rich, or if animals eat plant-based foods that were grown in soils that were selenium rich, then those food sources will also have selenium. We first discovered selenium deficiency in a region called Keshan, China, and this was a region where their soil was very, very deficient in selenium, and some of the villagers ended up having these kind of symptoms of selenium deficiency. The main symptom of selenium deficiency is inflammation of the heart muscle or cardiomyopathy, but this can lead to general malnutrition, improper growth, improper development, etc., as you can see pictured here. Copper. So copper is very important, and it is needed for our hemoglobin formation, so also plays a role in red blood cells, oxygen carrying. It's part of many enzymes. It functions as a cofactor. It's found in animal foods as well as seeds, legumes, and whole grains. We can have copper deficiency anemias. We can also have bone disease related to copper deficiency. There is toxicity possible, generally from copper supplements versus copper found in foods. naturally occurring in foods. I guess it could also be from contamination of copper. And there are two genetic conditions where copper is kind of a focus of abnormalities. So one is called Menkes disease. And in Menkes disease, the intestinal cells absorb copper, but they can't release it to circulation. So two things happen. One, you have no copper in circulation, meaning you can't use copper for hemoglobin formation as well as any of the enzymes, and it can build up in the intestinal cells, which is usually not as big of a problem because our intestinal cells shed quickly and they're sloughed off. For people with Menkes disease, they often have to get IV copper injections. And then there's something called Wilson's disease where too much copper accumulates, and it can accumulate in the liver and the brain. Manganese. So manganese is something you don't hear about that much. Manganese is a cofactor for many enzymes, and it's found in many foods, almost all plant foods. So deficiencies of manganese are very rare. Pineapple is a good source of manganese, and we don't see toxicity from general food sources of manganese. When we might see a toxicity is if there was an environmental contamination of manganese. Fluoride. I'm sure many of you guys have heard of fluoride. You may have some fluoride toothpaste at your house. Fluoride is important for formation of bones and teeth. Fluoride is found in soils. It's found in many plants. It's found in animals. It can be found in water supplies. However, many water supplies, fluoride has to be added to, and it's generally not found in bottled water. So most cities have added fluoride to their city water, meaning tap water, but bottled water generally doesn't have fluoride added. It's also found in tea, seafood, etc. It helps calcify or kind of form the healthy calcium layer on the bones and teeth. If you have too much fluoride early in childhood as the teeth are developing, something called fluorosis can occur. This can actually occur anytime, but it's more likely to occur in childhood and then last the life of the teeth. And fluorosis is not harmful. In fact, people who have fluorosis actually tend to have lower cavity levels than people without fluorosis. But fluorosis does not look very pretty. And mild cases of fluorosis can just include white spots on the teeth, but more severe cases of fluorosis can include these brown spots on the teeth, as you see in this picture. And it's very, very difficult, if not sometimes impossible, to remove this. Chromium. So chromium is important for carbohydrate and lipid metabolism. It's also associated with insulin function and enhances its activity. When chromium deficiency is present, people will have symptoms similar to diabetes. However, if you're able to give the chromium supplement, those symptoms can generally go away. That being said, you would think that a chromium supplement would help people who are diabetic, but generally speaking, we have not seen any promising results for people who are diabetic but not chromium deficient. Only people who are exhibiting diabetes-like symptoms due to chromium deficiency tend to see relief from a chromium supplement. Molybdenum. Molybdenum is a cofactor for several enzymes, and generally we get enough of it in our diets. Contaminant minerals. So these are minerals you don't want more of. In fact, you don't want any of. And these are considered toxic. The majority of them are neurotoxic, meaning they harm our nervous system, our brain, and our spinal cord. They can be found in water. They can be found in foods. They can be found as contaminants. Many people have maybe heard of lead paint, mercury in fish. Cadmium often comes from industrial plants and can leak into the water or the soils there. Why we're concerned about this. So starting with lead. Lead is indestructible. So once lead gets into our body, we have no way to get rid of it. And it will displace iron and calcium and zinc from metabolic sites. So if there's iron bound to your red blood cell as part of the hemoglobin unit, lead can kick that iron out and replace it, but lead can't carry oxygen. If you have calcium in your bones, lead can kick that calcium out and instead go into your bones, but it doesn't form that nice, strong structural component of your bones. Lead will compete with iron for hemoglobin synthesis, but like I mentioned, it does not carry oxygen. It can also compete with calcium in nervous function. So remember that calcium is important for nervous signaling, but unlike lead, it does not, well, calcium can send nerve signals, lead cannot. Lead also will interact with white blood cell production, which are cells important for the immune system. Mercury. So mercury we do see a lot in fish. That's kind of the big red flag one recently. And mercury can cause brain damage, kidney damage, lung damage, sensory impairment, and lack of coordination. We also have major difficulty getting rid of mercury. And then cadmium can cause respiratory damage, kidney damage, flu-like symptoms, and many neurological issues as well. Houses that were built before the 1940s, and some built between 1940 and 1960, even up until 1978, may contain lead paint. So if you do live in an old house or own an own house, you need to be cautious of this. Generally speaking, people don't eat paint, but infants might. Since lead paint is old, it may chip and fall into the floor, and infants will put everything in their mouth from the floor. I have not tasted lead paint. However, apparently lead paint chips taste sweet. And so if an infant were crawling on the floor and came across something that was sweet tasting, they would be likely to continue to consume this. All right, phytochemicals and functional foods. So we could do an entire semester long class on this, but this is a super, super quick intro. Phytochemicals. So phytochemicals are non-nutrient compounds, meaning we don't get calories from them, and they're not necessarily vitamins or minerals that we need for everyday reactions. However, they have a lot of biological activity, and this is generally a very positive biological activity. I have a picture of a rainbow of different fruits and vegetables, and colorful fruits and vegetables tend to be higher in phytochemicals. Phyto means coming from plant. If I said zoochemicals, that would be coming from animals, but phyto indicates that these are coming from plant sources versus animal sources. And some examples of different phytochemicals are capsaicin from peppers, curcumin in turmeric, lignans from flax, resveratrol in red grapes, allicin in garlic, lycopene from tomatoes. The list goes on. And many of these act as antioxidants in the body, scavenging free radicals and protecting us from oxidative stress. Functional foods. So functional foods have active compounds and often have phytonutrients added to them. So for example, these eggs have omega-3s. If you feed chickens a meal that is rich in omega-3s, you can produce eggs that are high in omega-3s. Benecol, this is a butter type spread. It's not butter, but it's a butter type spread. And it has plant sterols that have been added to it. And plant sterols actually help reduce cholesterol. Activia, this is a yogurt with added probiotics and prebiotics in it, bacteria cultures that can help recolonize your intestinal tract. Tropicana with calcium. Tropicana doesn't naturally have calcium in it. So different foods where they've added different components. These are pictures of foods and some of the phytochemicals that they may have. So blueberries, for example, have anthocyanins, flavonoids in tea, monoterpenes in citrus, tomatoes, I already mentioned lycopene, spinach has carotenoids, lutein, and zeaxanthin, which is good for the eyes, etc. So quiz. Iron absorption is impaired by, so this means what makes iron absorption worse? Hopefully you said phytates. Which of these people are more likely to develop an iron deficiency? Hopefully you said 17-year-old girl. She's a teenager. What does this say? Are more likely, or least likely. Sorry, a girl is more likely to. 52-year-old man is least likely to because he's not growing and he's a male, so he doesn't have a menstrual cycle. Which of the following would not describe the blood cells of a severe iron deficiency? So they would be anemic. They would not be pernicious. Pernicious has to do with B12 related anemia. Microcytic means small and hypochromic means pale. So they would be small and they would be pale. Which provides the most absorbable form of iron? Hopefully you picked an animal food, the steak, because it's going to have heme and non-heme iron in it. The intestinal protein that helps regulate zinc absorption is metallothionein. A classic sign of zinc deficiency is growth retardation. Cretinism is caused by deficiency in iodine. The mineral best known for its role as an antioxidant is selenium. Fluorosis occurs when fluoride is excessive. And which mineral enhances insulin activity? Chromium. Okay, thank you guys for listening today, and we'll talk more later.